Hello, everyone. This is Dr. Brittany Martin with the American Marketing Association. Thank you so much for joining us for today's webinar. We have 4 phenomenal speakers for you today. We have David, Tom, Amber, and Carolyn, who's going to join us in just a moment. But before we get started, I just wanted to point out a few of the console features. You'll notice over to your left-hand side that we have a studio chat. If you haven't already, feel free to share your location. Also, next to that studio chat, we have a questions and answers tab. So if you have any questions for our 4 presenters, please ask your questions in that tab. Also, once we conclude, this presentation will be available on demand. So without further ado, we're going to jump right into the presentation and get started with David.
Thank you very much, Brittany, and welcome everyone. Looking forward to a really interesting hour of discussion here. I'm going to jump straight into some quick introductions here for David, for myself, Tom, Amber, and Caroline. This is David Allen. I'm the director in the healthcare strategy team at Perficient, focused on digital health. Tom, you want to quickly introduce yourself?
Yeah, thank you, David. My name is Tom Swanson. I'm the head of industry strategy and marketing, particularly for health and life sciences at Adobe. Been with Adobe for, gosh, I guess almost 4 years now, and come from the medical device and pharmaceutical space, right? So I've actually been on the other side of that table in terms of attempting to implement marketing technology in a highly regulated space. And so hopefully I can bring some of that perspective to the discussion today.
Thanks, Tom. Amber?
Hi, this is Amber Kember. I'm the manager of creative services at Blue Cross Blue Shield of North Dakota. I've been with the company for 15 years and just recently led the implementation of the Adobe platform with the launch of our new website in February. And now I'm continuing on to lead the strategy and enhancement of our digital platform to continue and enhance our customer experience.
Awesome. Thanks, Amber. Caroline?
Hello, everybody. I'm Caroline Santos, Associate Director of Digital Strategy at Cedars-Sinai Medical Center in Los Angeles. I currently fall under the Marketing and Communication Division, and I've been with Cedars-Sinai for 9 years. And currently, we also have implemented and launched a new website on the Adobe Experience platform.
All right. Fantastic. So quickly talking you through what we're going to cover today. Tom Swanson and I are going to give a little bit of a setting the scene for the discussion today. Obviously, the focus of this is the state of digital health, especially with a perspective on the current COVID-19 crisis and how the digital health environment is reacting to that, and specifically how some of our panelists have been leveraging their digital footprint in the context of that situation and leveraging the content management stack in the context of that situation. So Tom and I will talk through a little bit of background, and then we'll dive into 3 kind of discussion sessions. One focused on the use of digital tools in the context of the current crisis. The next really focused on helping our panelists tell a little bit of their story of how they've built out their next generation content management capabilities and kind of really some interesting experiences there. And then finally looking more forward-looking, both from the perspective of our panelists and also where they would like to see content management capabilities and Adobe's capabilities building out. And sprinkled in there, as you'll see shortly, we have a couple of polling questions to keep it interesting, so keep your eyes out for those and jump on those. That would be great. So I'm going to hand over to Tom to take us through a few observations, and Tom and I will bounce back and forth a little bit, and then we'll get into the meat of the panel discussion. Tom?
Thank you, David. Yeah, thank you very much. I think, all of us that live and work in the healthcare industry right now, of course, are experiencing some significant disruptions and kind of changes in our, strategic and our business models as a result of the circumstances that we find ourselves in right now with COVID-19. I mean, even outside the healthcare industry, right? Everyone is feeling the impacts of what we, are being asked to accept kind of as the new normal in not only how we interact with our healthcare ecosystem, but how we interact with each other. And what I've done here, David, is actually just kind of snag a few data points to illustrate the changes, right, or the disruption that we're currently going through. And I don't think anyone would be surprised, right, that we're moving significantly from a kind of high-touch, low-volume model of customer engagement to a low-touch, high-volume, right? And what that means is, we're seeing a tremendous increase in telehealth or, kind of video engagement with your healthcare providers in the last 30 days as we shift away from kind of in-person visits and consultation. And I think that is borne out by the stat that you'll see in the lower right-hand corner, which is 50% of consumers right now are actually afraid to go to a doctor's office or go to a hospital, to seek potential treatment because they think they might be exposed to something that, they otherwise wouldn't be. 85% of consumers are worried about actually being able to access healthcare at this time. Or they have questions about their coverage, will they have to pay for testing? Are copays going to be waived, right? Availability of that information has been kind of difficult to find. One of the biggest problems that we experience in healthcare is collections, right? So once products or services or treatments have been delivered, collecting payment on the back end has always been problematic, and we're actually expecting that to get significantly worse as a result of the pandemic. And then I think one thing that actually is very interesting, and I know we're going to have the opportunity to kind of emphasize that with our panel discussion today, is that healthcare companies, right, whether you are talking to your customers or talking to your employees, are viewed as trustworthy sources of information in uncertain times, right? So your employees are looking to you, right, for guidance on changes in policies and changes in procedures and things like that. And then you've got customers that are looking for you for leadership and guidance, again, around, what do I do now in these circumstances? Who do I contact? How do I contact them? Where do I go? Are you providing with kind of updated and timely and personalized information where you're giving me updates on a real-time basis to what's going on in my particular area? And I think that that's an opportunity that all of us in the health and life sciences space have right now, is to leverage that position of trust and to be able to respond to our customers' needs in real time in a personalized basis in order to kind of give that confidence and give that direction that they're seeking right now. David?
Thanks, Tom. And I think you hit a lot of really key points that we're going to talk about a little bit later in the panel sessions. And really, we share the same perspective at Perficient. Communication is key at this time. And there's a lot of also making the right claims for the different parts of your digital health infrastructure. There's a lot of noise in the environment, a lot of people looking for information, looking for insight. We've seen a lot of emphasis. You mentioned virtual visits. That's obviously a key focused area, as is just the emphasis on triage and chatbots. And that's that's really fantastic that there are lots and lots of tools out there, and we have our own initiatives in that regard as well. And I think the message is really that each one is just one part of a journey. And to that end, I really like this quote, just to maybe set the scene for some of our conversation. The quote from Dr. John Halamka of the Mayo Clinic platform: "If you're feeling that the future will be more Mad Max than Star Trek, realize that people around the world are working together to create the best possible outcome." And I think that really applies in the context of digital health as well. Mad Max conveys ideas of, old cars with weapons and weird things strapped onto them, and Star Trek is a little bit more of an integrated, interoperable world that we're aiming for, and that's what we're trying to do here. But it's going to be a balance between those, absolutely. And I think to that end, you'll see some pretty interesting stuff. I don't know if everyone on the webinar has come across the story of Kinsa Insights, pretty interesting story around digital thermometers and the kind of the fever heat map they've built of the United States. Not promoting this as a solution that solves all problems with relation to COVID-19, but just a really interesting example of digital health at work in this space. And the folks can read up on it, but the long story short is they're able to use their digital, aggregated data from digital thermometers across the country to start to do a kind of an early warning role with respect to fever levels across the country. It's pretty interesting, some of the connections they've been able to make. But I raise it really just because it kind of emphasizes some of the points that you've made already, Tom, which is, you've got a lot of data points, a lot of integration points for patients and health plan members trying to get a handle on how they should respond. And the point of authority on that is going to be the digital footprints of our hospital systems and our health plans. So real big opportunity there. Tom, I think you wanted to talk a little bit about some of those current business issues that you've summarized here on this slide.
Yeah, David. And this is drilling just a little deeper into, I think, the importance of communication, right? And being able to kind of communicate or over-communicate, right? Communicate early, communicate often, and, personalize those communications or personalize the content in real time and at scale. Because for both customers and for employees, right, there is fear, there's confusion, now there is isolation, and none of those things lead to good places, right? And so they are seeking information from, health plans, from healthcare providers, from healthcare experts, in order to help them kind of reestablish normal behaviors, help them reestablish routines and understand. I mean, I think all of us as healthcare consumers would probably be honest in saying that our experiences, right, or our engagements with our payers and providers are not necessarily always positive, right, and that there has been a bit of a lag in adoption of digital technology in the healthcare space relative to other industries, right? And there's finally this kind of consumerization taking place in healthcare, or where experiences that customers have in banking or in travel and hospitality or in retail are beginning to finally pull through into healthcare, where as consumers, we expect to have very similar experiences. And this is a prime opportunity, right, to address those immediate consumer needs while kind of setting the foundation for continuing that level of personalization and that level of engagement moving forward. And the same is true from the employee side, right? Because if you think about it, your employees are customers just like your external customers, only they have a different need set, different value drivers, and different requirements in terms of interaction. And we need to make sure that we address those when we're making these digital transitions in the same manner that we address the external customers. David, anything to add on that side, or we can move on?
I'm gonna hold some comments on that until we get into the panel discussion, just in the interest of time. So I wanted to jump through a few of these slides if you want to hit the high notes on the next couple, and then we'll get ourselves ready with the end of this session, this segment rather.
Perfect. Now real quickly here, I think, and this isn't surprising to anybody, that if you are engaged with a company that is responding well to a crisis or responding well to an emergency, that you are more likely to do business with that company or continue to do business with that company. So there's a degree of loyalty that can actually come out of a challenging situation. And this is what I was referencing earlier, right, where consumers or customers are actually looking to employers and to healthcare experts as sources of trusted information beyond government sites or traditional media and social media. There's a level of trust that comes from your employer or from a healthcare company that isn't experienced with other segments of our communications.
Yeah, absolutely. And I think the message that we'll get into that ties back to this is that we need to make sure that we manage and live up to that trust with clarity, with consistency, with kind of up-to-date and informative information. And that's kind of some of the things we're going to talk about in the first part of the panel session. So just before we get to our polling question, I think, Tom, you wanted to set up this next discussion that, businesses are really moving towards a set of new demands as a result of this situation. And really, they kind of accelerate some digital health demand trends that had already been in place, but really kind of are now accelerated. So I'm going to flip forward to this slide and just let you kind of make the quick points you wanted to have on this, and then we'll jump to the polling question because I know everyone's excited about that.
Perfect, David. Thank you. Yeah, as healthcare companies address, right, the demands of the current situation we have, it's important that they keep in mind that any actions that might be accelerated relative to digital transformation, like David was just referencing, are foundational in nature, right? Which means, yes, they will help you address your immediate concerns from your customers and your employees, but it's going to set you up to better serve them in terms of digital engagements and communication and self-service options and access points in the future once we're through this particular crisis, right? And so what we did was we actually identified 6 fundamental pillars of opportunities, right, that can be addressed through the deployment of digital technology in the environment that we're in right now. And the first, or the central pillar, right, that supports the other is gaining a deeper understanding of your customer or gaining a deeper understanding of your employee. So using the data that you have or the data that you will continue to collect to know who they are, what their concerns are, how they wish to be engaged, and then anticipating their needs as we move forward. And that data then can be used in these other pillars, right, of discovering new or more efficient ways of working, shifting to a virtual or remote model versus in person, right? We've talked about proactive communication and outreach in order to provide relevant and personalized information real time through all of the different digital channels that are available. Adopting the technology and providing self-service options. At the very beginning, when I talked about moving from a high-touch, low-volume model to a low-touch, high-volume model, self-service, right, the ability to do kind of non-critical things on your own is going to become all the more important. Shifting your brick-and-mortar strategy, right? So if you're no longer driving people to your place of business, how can you utilize the place of business or the physical resources and the physical assets that you have in a different way, and doing all of this while still maintaining a strong and viable presence in your local community, right? So David, let's get into the polling questions and start the discussion.
Yeah, absolutely. Thank you, Tom. And I think, to your point, just to close out on that, and I'll put this up so people can start to look at the polling question, but just to finish off your point there, that it's the coordination of all of those different channels the website itself, chatbots, virtual health, etc., is a critical part of today's environment. But also, we know that a lot of our clients are addressing that question around how they coordinate clinical IT and marketing in this situation, and I think we'll spend some time talking about that as well. The polling questions, very good job. Everyone started working on it already. So what has been the most impactful channel your organization has utilized in its response to the COVID-19 crisis? The options are website, chatbot/AI, virtual engagement, and other. So we'll just give another 15 seconds or so on that, and then we'll dive into the first panel session. All right. So I think these numbers will start to bounce up, and I think these are really pretty much in line with what I think we were expecting as a group when we got into this. It's a kind of a balance between the website and virtual engagement. I think the focus of this discussion is obviously going to be on the website, but I think the panelists will be ready to have some observations about their organizations in that regard as well. So this is great. Thank you very much, everyone, for responding. I'm going to jump into the first discussion topic, and I'm going to line up to if you can address the questions first, Caroline, and then we'll dive into a little bit of discussion. But the sessions we want to talk about here, and I'll just kind of reference a number of questions we want to try and cover, really how your organization, Caroline, how Cedars has been leveraging the capabilities of your digital stack in your response to this crisis, and what some of the most effective tools you have seen coming to the forefront, and also, what role the Adobe stack has been able to play in that. So, Caroline, would you kick us off with some observations on those?
Sure. Thanks, David. So for us, looking at those poll results again, it is true for us. The website has been our main, response for the COVID-19 crisis. As Tom and David have mentioned throughout the presentation, over-communication is key for our, employees, for our caregivers, for our patients, our community. We are also an academic medical center, so there's, recruitment going on, et cetera. So, it's really a time for us to make sure that our website is up to date with visitor policies, FAQs, changes. And in Los Angeles, these changes come literally hourly at this time. So there's always a response or an update, and being able to use Adobe and AEM for that on-demand publishing, almost like publishing in real time, has been huge for us in communication. For all our stakeholders, obviously. I mean, even like location closures that tend to happen middle of the day, those can get updated, and we can reroute questions as well as patients to other areas. Other effective tools have been our video visits or telehealth. That has helped us a lot as far as, some of these appointments. And as Tom mentioned, many patients are scared to come to the hospital to get checked or to have some, of their appointments. And so video visits or telehealth has been a huge tool that we have we're slowly on the uptake on, but definitely has ramped up because of COVID-19. And then just overall, the components and reuse of our site. When we created the website for the COVID area, we did it in less than an hour with information that we have, and we continually update it and are able to keep the content fresh and engaging and, following our brand standards and whatnot. And just a note for some analytics that we have seen, once we added like a banner towards the top of our website, the uptake of people going to our COVID section, like within the last 3 days, has been over 1,000 every day, and it just keeps rising, obviously. And so people are looking for the content. They are, searching Cedars-Sinai or any of the care centers here for information. Amber?
Hi, thanks, Caroline. Yeah, we are using our website highly as well. I think we have really enjoyed the flexibility that the Adobe platform gave us to be able to build that site really rapidly to respond to this crisis. We were able to use similarly an alert feature that runs across all of our site to drive traffic to a dedicated COVID section that we've been able to build out. And as a health plan, we provide services to not only our members, but also the employer groups who employ those members and the providers who are seeing our members as patients in their hospitals and clinics. A lot of our focus has been around making sure that our members have the information they need around the benefits that they need to take advantage of during this time. And with telehealth being new to a lot of people, we're making sure that they know not only what's covered as far as telehealth services, but also making sure that they have access to those services, whether it be through their provider or through an affiliate partnership that we have that provides telehealth services directly to our members as well. So we're just trying to create a good balance of making sure members have the information they need while they are staying at home right now around the health benefits, when they may be wondering where to turn or what's covered or what should I do, but also providing them those kind of general health and wellness tips too for staying at home and social distancing and practicing good hygiene practices during this time as well. So it's just been a broad mix of things, and it's been able to build out quickly.
Thank you, Carolyn and Amber. This is Tom. I have a quick question for both of you related to this, right? You both mentioned, how you were able to stand up websites very quickly, or, update communications kind of in real time, right, to address the immediate needs going on, for your audiences. Now, do you actually have, staff in, your own staff that actually does this stuff, or are you dependent upon agencies? Just curious, how easy it is to do this real-time adaptation, just with a relatively small staff.
I could take that.
Go ahead,
Cedar,
Carolyn.
Okay. For Cedars-Sinai, we actually work with our internal communications team. So they help provide us with the content. Obviously, they know they have an operations call daily. So as these changes come in, we kind of work through a PM team that helps us, which areas need to be updated with what information that's approved, when does it need to go live, et cetera. So we do have an internal group that is dedicated to COVID and has been dedicated to COVID now for weeks, and will continue. And that way, not only is our website updated, we also have obviously an internal intranet site that needs to have similar information. So that way, staff can make sure that when they are meeting with patients, the messaging all stays consistent.
Yeah, this is Amber. I'll chime in as well. We have a really small web team. I only have 2 web authors. It's really easy to be able to update the site. In fact, I really don't have any background in website development or building, and I've been doing several of the updates myself just because of the capacity at which the changes have been having to be made. And so I found the platform really intuitive and easy to use, and I'm able to quickly pick up on things or figure out different things. If I'm not exactly certain how to do something, I've been able to adapt and adjust really quickly to be able to give us constant updates.
Thanks, Amber. So that's really helpful to understand that level of flexibility. And I have a kind of a follow-up question as well, in that, this is for the long term, right? So yes, some of the things that we're doing right now are reactive to the environment that we face right now, and that's the emphasis on information changing every hour. But this is also presumably going to be something that you're thinking about longer term as we move into post-peak, hopefully not too long from now in the United States, at least, and how this plays out, and therefore some of the ways that you're going to have to think about content management and kind of content strategy for an environment where people are using digital engagement with your organization at a much higher level, virtual visits, that kind of thing. So presumably that's also something that the flexibility that the tool gives you, that the Adobe Stack gives you here is beneficial in kind of thinking about that future strategy. And either Caroline or Amber, any thoughts on that?
I can jump in. We have really appreciated the ability to move things around without having technical resources, and I think that gives us long-term flexibility. So in the past, for example, our menu structure would have had to be adjusted by a technical resource, but we can do that in the business. So if we see demand shifting, we're also using the Adobe Analytics platform, so we can see what content people are digesting and use that to reposition the content within our site for a higher priority on the items that our consumers are digesting.
That's awesome. Is that you have similar thoughts on that, Caroline, or Tom? Any observations you would make on that kind of longer term view?
I could jump in here. I agree with Amber. Very similarly, we don't have a large team as well, so there are a set of maybe 4 authors that do, the actual publishing of the content. But we have, within working through this pandemic, we've obviously had to change processes. But the flexibility, I completely agree, of being able to do things without having IT to create something new or to put up a page or to stand up a URL or something, it's definitely been a perfect, thing for the marketing team to get things out more readily while IT is working on, infrastructure changes or whatnot. So, I agree, and we're in a similar position here.
Awesome, thank you. I'd really love to spend the whole time talking about all of these pieces. Tom, any final comments on this piece and before we move on to the next segment?
Nope, all good, David. Let's go.
Awesome. All right, and folks on the line, please, be storing up your questions when we get to the Q&A, which will be in about 20 minutes time. So, so jumping into the next discussion area, and this one is really a little bit more kind of the story to date. So I'm going to ask Amber if you can kind of tell us a little bit about the journey you've gone through there in North Dakota in deploying the next generation content management system. What have been the key learnings you have in building that environment, working with your partners, highlights in respect of specific functionalities and capabilities. I think we talked a little bit about that already, but any thoughts you have, I guess, in the journey you've taken to get to where you are and learnings that you would communicate to the group?
Yeah, I think we started our journey by selecting a partner, and I think for us, one of the really important things in selecting that partner was making sure that we were satisfied that they were technically competent, but that they were also able to meet us culturally where we were at as an organization. I know in technology, people often say kind of crawl, walk, run. And I would sometimes say, hey, we just need to pause. We're still at the rollover phase of this particular piece. And having a partner who was really able to understand that and willing to work with us and come together in that was really helpful. I think another big thing that we found organizationally is that historically these implementations have been run from an IT perspective, and we ran this implementation from our business perspective. Our time from implementation kickoff to launch was about 8 months, and we found that we were really successful in being able to let our business really drive what their priorities, approach, and strategy was around how we built out the platform, what flexibility we wanted to be able to have to allow us to be able to make changes and to continue to use the platform in a very robust way ongoing. And then just having a strong partnership with our IT division for their support as we went through the build gave us a unique perspective. And so I think that was an interesting change for us as we went through this implementation.
That's really helpful. Thank you. And it really kind of emphasizes that point we had earlier on around coordinating, IT, clinical, and marketing kind of very quickly. In your case, a different kind of constituent group, but having that internal coordination then be mirrored in a highly flexible system as well is really a key part of it. Caroline, what are your thoughts on the journey you've been through with Cedars?
So similar to some of Amber's comments, Cedars-Sinai had about a 14,000-page website that just needed a heavy lift, a lot of content strategy, some obvious updated internet architecture and information architecture, just because it was very unruly. And so when we did begin this journey, it was a 2.5-year journey for us. We did start out with making sure we had key stakeholders or champions. So we had set up a steering committee that, kind of represented our physicians, our IT department, our, marketing was obviously involved, and then, our researchers, our academic area. And that helped us a lot as far as the overall digital transformation and just, getting our internal stakeholders on board of what we wanted to do as far as platform selection and moving into a more patient engaging and user-friendly website where it's not so much internal talk of things that, maybe internally we'd understand, but more focused on our patients, our caregivers, our possible medical staff, et cetera. And so we did also want to make sure that we weren't fully IT dependent as well on things. And so we made it a point to have the AEM set up with a partner that allows us, again, like Amber had mentioned, flexibility, this on-demand kind of information engagement, and then just overall reusability of components, making sure that it's mobile friendly. It was a huge lift to make sure that, the website information was readily available in a mobile friendly design. And then accessibility was a huge lift for us as well. And so part of that with our brand guidelines and just really focusing in on, our consumers and our patients was important in this engagement. And while it took some time, I think it, came out after 2.5 years, a great start or foundation, but obviously we will continue to build on this even more.
Thank you. Yeah, and I think it's absolutely a balancing act on multiple levels, on a technology level, on a internal governance, and kind of how you kind of herd cats at times to kind of drive towards that. And I think what's really interesting that's come across from both of you is that the Adobe stack can ramp quickly when you need to, and can be a kind of a key partner, if you will, in that experience, regardless of the environment that you're trying to work within. Any comments on that, Tom? Any thoughts on that?
No, David, that's exactly what I wanted to point out, right, is that, yes, while, Amber had a journey that lasted about 8 months and Caroline had a journey that lasted multiple years, I think it's important to note that, in the current circumstances we're in, there may be a need and an appetite, internally for herding those cats to move much, much faster, right? Because there's an imperative now. And standing up the technology stack can be done extremely quickly, right? And you prioritize the things that you need to do right away, right? So if real-time and scalable communication is, priority one, you stand up and execute on that first, and then you move into, kind of content management and dynamic creation of content. It all gets back to the thing we said at the very beginning of our discussion about anything that you do now relative to digital transformation to meet immediate needs is going to be foundational towards maintaining and growing and improving your customer experience moving forward once we're through the urgency.
Yeah, absolutely. And I think we can jump on to the next piece here, but I think, we'd heard any references to working with our, both your partners and with Adobe. Any kind of closing comments on that from you, Caroline or Amber, and then we'll jump into the next polling question. It's almost like we timed this accurately.
I just think that, like I said, the right partner selection was really important to us. It probably was, to Tom's point, something that could be done very quickly, and a lot of our hurdles were probably more around internal governance, content strategy. We did a redesign of our site and different things like that. So it wasn't all tied to just the build out of the platform. But for us, it was really key that we had a strong partner and a partner that could meet us where we were at. We just really weren't ready to be in a place where we had a lot of deep technical investment from an organizational perspective, and so we needed our partner to be able to bring that piece, and that was really helpful to us throughout the entirety of the project, and it continues to be. We launched and we continue the partnership, and we have a contract in place for the remainder of this year too to continue to do future enhancement and future build. And I have Perficient on Skype, and I'm often reaching out to say, hey, can you help me with this? Can you help me with that? Even during this crisis, to pull different COVID analytics and different things. I have relied on them heavily, and it's been very beneficial.
Awesome. Thank you. Caroline, any thoughts? And then we will jump onto the polling question.
Very similarly to Amber, we did have a selection for a partner as well for implementation, and yes, a lot of the internal battling probably was most of the time taken to build up the new site, but we also did exactly similar to what Amber had done, a complete redesign and revamp of a site that hadn't been touched in several years. So it did take some time, but Tom's point is correct. Standing up the instance wasn't the difficult part. It is the, making sure we have the right content and the strategies behind that, and that, buy-in from everybody.
Awesome. Thank you. So it's almost like we planned this. So we're going to jump onto the polling question that's kind of to the points that Tom and Caroline and Amber were making. Looking forward, how do you make sure that we're emphasizing the most important areas of the digital technology stack over the next couple of years of activity? And we'll hear from our panelists a little bit about how they're thinking about that. But in the meantime, here's another polling question for everyone, if you can see it. And this one is, where do you see the most emphasis in your organization's digital technology stack over the next 2 years? And the options are content delivery as a kind of a broad category, automation, content generation, campaigns, and so on, AI and chatbots, call center integration, virtual engagement, and other. So let's put some thought into that, and we'll take that jump, and we'll move on to the results, and those will kind of flavor a little bit of our discussion in the next segment. So it's almost like a kind of a meta view of digital health, virtual engagement, pushing up as the next big topic in both of the polling questions, which is great. So the results that we see coming through, we got about half of the group noting content delivery as being the focus over the next couple of years, and just over a third virtual engagement, and then a few other areas. I guess I'm personally a little surprised at the low showing for AI and chatbots in the context of what we're seeing today. But I think maybe that's just a reflection on the phrasing of the question more than anything. But interesting observations to take into this, and Caroline, I'm gonna ask you to respond first in this last section here before we hit Q&A from the audience here. So the last discussion topic is kind of looking forward and growth and experimentation is what we're thinking about here, the road ahead. So what are the key capabilities in the Adobe stack that you expect to be exploring and building out over the next couple of years, and maybe with your kind of future telling hat on, what are some of the capabilities you would want to see enhanced and expanded in both the Adobe stack or in general in terms of integrations with other digital tools that you lean on at Cedars. So, just restate that. What are the key capabilities that you expect to explore going forward, and what are some of the things you would want to see as enhancements and new capabilities? Caroline.
Thanks, David. So going forward, we actually are in the middle of an implementation for Adobe Analytics. Currently, we're using Google Analytics as our source, but we will definitely be looking to data, which is kind of like the talk of everything now, and that will help drive, obviously, our content, our messaging, and whatnot, and what people are actually wanting to see. So adding Adobe Analytics to our stack currently will help us with that, and we also are starting to run more testing. So we have Adobe Target as well set up, and that helps us just to see what users are doing on the site, helps us with some user experience, some data there, and whether or not, changes to the site, whether it be a button change or an image change, makes an impact on how people are interacting with our content. So those are two of the key areas in the Adobe stack that we're focusing on in the next probably 6 months. And then we're going to look into Campaign, which also is on the list of tools, and that we'll use for, our messaging. So a lot of our tools right now are kind of in different areas. Different people are using other, mail service areas or, sites and whatnot. And so we would like to get that all into one place. So again, that messaging, that communication is all funneled in one area with the same message, with the same branding. So, patients, caregivers, everybody who are getting information from Cedars-Sinai are kind of getting that, same look and feel, and overall messaging consistency across the board. Another area, too, that we were looking into is throughout our hospitals and in the actual physical buildings, we have digital monitors. And so those serve as, great tools that we can use around the hospital for information, for wayfinding, et cetera. And so we're looking to possibly, Adobe has Adobe Screens that we might be looking into to help us get that content more engaged in a, more physical locations around the institution and our affiliates. And then, looking forward, it's interesting the chatbot poll, because that is something we are looking into to use on the site just to help with some of the questions or call volume that we do get in various, our call center and other areas, thinking that will help to, again, provide that information when needed if they're, searching on the site and they're just trying to find something simple and they just can't seem to find it or navigate it. So we're looking into some chatbot integrations, and also find a doctor tools. That's another kind of area that we want to explore more. We have a tool now, but we want to make sure that, it again is integrated with our site and it makes sense and it follows the journey as a patient or a new patient or even a caregiver to get the information they need when they need it and when they're looking for it. And that's
awesome.
pretty
Thank
much,
you.
I think, going forward. Yeah.
Yeah, thank you. And it's kind of all like options and segmentation for people to get to the right options at the right time. And I really like the discussion of the digital monitors. I think the sheer number of screens we're having to plan for is one of the big challenges we all face, and I think is going to be even greater emphasis going forward as we get to the new normal after COVID. Amber, want to open the floor to you on that topic, looking forward.
Yeah, I feel like Carolyn and I are on parallel roads here. So very similar. We implemented analytics and Target along with our AEM implementation, and over the next 6 months, really looking to see how we can place our content better based on the data that we're seeing and leverage that data a lot more holistically than we have done in the past. And then also move towards some content personalization based on the audiences and the targets to make sure that people are seeing the information that's most relevant to them. And then I think longer term, in the next year to 18 months, really looking at that marketing automation strategy. We have some marketing automation today, but it's very disjointed and comes from segmented data sources. So centralization of data to make sure that we can leverage that to get the right messages to the right people at the right time. We're also looking at Adobe Forms. We have a large number of forms on our website, and that would allow us to be able to intake those forms and route them automatically throughout our organization and reduce the amount of touch that those have, as well as really increasing that experience for our members and providers who are submitting that information to us. And that tool we've also found probably has extensibility for us beyond our website to be able to create personalized documentation for distribution, whether that be through a digital channel or a print channel. So really exploring that tool and what options that may bring. And I guess I'm just going to put a plug in, for what I'd like to see down the road. I watched the Adobe Sneaks yesterday. If you haven't checked it out, I would check it out. And I really want to see some of that AI personalization. There is a lot of work to be done to be able to make your content relevant to individuals, and I think that it's so important that we're showing people the information that they really want to see. And I was really excited to see Adobe investing in looking at ways to automate and streamline that for us business users so that we can provide information to the people that's relevant and pertinent to them. So if you haven't watched that sneak, go and check that out.
I like that.
Nice.
Yes.
Yes, that was a nice plug, Amber. Thank you.
Yeah.
Yeah,
Tom,
David,
you want to give a quick,
Yeah,
Tom, just give a quick summary of the Adobe looking forward. Then I want to jump to Q&A, so we have to give a little bit of time for that.
Yeah, perfect. I mean, Amber hit on it, right? I mean, the big investment that Adobe has been making in our technology stack is around machine learning and utilization of AI, right? In an attempt to further streamline, the automation of the very things that we're talking about, whether it's the dynamic creation of content or, audience segmentation or, channel identification and delivery of personalized content through the right channels at the right time, right? These are all things that I know all of us want/need to do, but in reference to the question I asked earlier, particularly around availability of resources, right, and internal staffing versus, reliance upon, external resources, the ability to utilize AI, right, to make the observations based on the data that you're collecting and then make recommendations on actionable insights that come out of the data is a critical step forward, not only for Adobe, but for all of us.
Awesome. Thank you, Tom. That's really exciting stuff. So I want to open it to Q&A. I just want to double check, Brittany. I don't know that I'm seeing a huge number of questions unless I'm misinterpreting, and that's fine as well. We can do some closeout. But if anyone has questions, please type them into the chat on the left. There's a Q&A segment.
All right, perfect. So I think typically our audience will ask general questions for entrepreneurs or small business owners. Do you have any general advice for how they could potentially get through this time period?
So I think, if that's the broad question, I think, the group would agree that it's probably at this time it is about, and I guess you can take this different ways. At this time, it's really about communicating options and really having kind of the key 5 or 10 messages very clear. I'm assuming the question is associated with those kinds of entities getting communications out about their capabilities or to customers in some way, or to potential people to work with. I think it is really, there is the challenge we have right now. We have an environment where there's a lot of noise in any given topic. Right now, we're in kind of triple overload. So it's really the emphasis on getting the key messages across. I don't know if any other folks on the panel would have a response to that to kind of add to.
I'll chime in and just say, yeah, I agree. I think it's generally about making sure that you are delivering the right content at the right time and just trying to stay ahead of the topics that are relevant to your audience and your people. I don't think it has to be robustly technical if you don't have the resources at your disposal to be able to readily do that. But I think it can be easy and it can be quick, and just being a trusted resource in this time is what's really important.
All right,
Thank you.
great. And it looks like we have a few additional questions that have come in. Katie just asked, when you say you are investing in AI for dynamic content creation, meaning AI would write the content for the site, what type of content are you referring to?
This is Tom. That's a great question, Katie. And what I was referring to when I talk about dynamic content, it really is more around assembly, right? The thinking is that, whether it's your website or your app or, text messages, however it is that you're communicating, right, that you would use what we call content fragments, right, which are like small bits and pieces of content that can be text, they can be images, they could be clinical claims, they could be benefits packages, whatever it might be, right? And all of that, those content fragments are pre-approved. So then what you can use AI to do is, based on behavioral cues and based on the data that you're collecting about particular customers, then you can dynamically populate the templates with the appropriate fragments, right? So it's not as though you're generating, and I'm doing air quotes here for those of you, that can't see me, which is everybody. It's not as though you're generating new content. What you're doing is generating a new iteration of pre-approved content fragments that's being delivered to a customer, and it looks like it's been completely personalized for them.
All
right.
Thank you.
And in from Michael, if we could maybe squeeze in one final question. How does digital health help reduce anxiety, or what is the response? I guess, how are we managing individuals' anxiety during this time period as well?
So I'll take a stab at that to begin with, and then if other panelists have an opinion. I think that we are in an interesting time in that there are a lot of different digital therapeutic companies. We're really been coming to the fore in the last couple of years. I would, again, not a specific plug, just an entity that I'm familiar with, a company called Happify is an example of a digital health tool associated with managing mental health issues, and actually they have some interesting capabilities that are kind of pointing directly at that anxiety problem today. But in terms of a broader, just how your digital footprint as a provider or a health insurer kind of contributes to that, I think one of the key ways is to make that search for information as clear as possible. And we always talk about also being very clear when you don't have an answer to something. That's a really key part of when one is doing any kind of search activity, regardless of whether it's in the context of something stressful like this, having a kind of a MECE approach to it is really, really important. So I don't know if Amber and Caroline, you would have any comments on that.
I can chime in a little bit. We have expanded our telehealth coverage to cover these types of items. So kind of eliminating that barrier between an individual and their provider. They can get services for anxiety or other mental health ailments from their own home, and we find that increases individuals' comfort level with seeking those services to not have to go in somewhere. So just providing them information through our web platform about how they can access those telehealth services and what services are provided under that coverage, I think has been beneficial for us.
Awesome. All right. I think we're just over on time. Brittany, do we have time for a closing comment from our panelists?
Yeah, absolutely. So audience, we're going to let our 4 presenters conclude, but go ahead and start typing in thank yous into the chat to give all 4 of our presenters a virtual round of applause. And just a quick reminder that this presentation will be available on demand. So let's go ahead and close out. We'll start with David.
Sure. Well, thank you all for the time here. This was a really awesome conversation. Thank you, Caroline. Thank you, Amber, and thank you, Tom. Really, really interesting stuff. I would happily spend all day talking about this stuff with you. So thank you. Tom, you want to say a few words, and then we'll hand over to our stars here.
Yeah. Thank you, David. No. Same thing. Just thank you very much, right? I think I've been responding in the chat pod. This is exactly the kind of discussion, right, that we were hoping that we could cultivate and spur amongst the participants. And so thanks very much for spending a little more than an hour of your time. And look forward to opportunities to continue these discussions in different forums.
Awesome. Caroline?
Just to thank everyone again for the time and the discussion as well. It's a very interesting time, outside of the COVID, there's this digital transformation, I think, overall in healthcare and with many healthcare providers and hospitals, et cetera. So this has definitely been a great conversation of, moving forward digitally in the healthcare space, which, in the past has been pretty behind in many things. So thank you.
Thank you. And Amber?
Yeah, just thank you for the opportunity to share and to have this conversation today. I think it was really helpful. I think as you're getting started, it seems kind of overwhelming, but this really is an easy thing to implement, and it's easy to understand and use once implemented. And so I think don't get overwhelmed kind of by everything that's in front of you, and just take a really streamlined approach. I'll speak for myself, but I'm willing also, if people are kind of getting started and not sure where to go, if anyone wants to reach out on LinkedIn, I'm willing to, chat with you there as well.
Awesome. Brittany?
All right, great. So we're going to go ahead and wrap up for the day. I see a couple comments. A lot of people enjoyed the presentation today. This presentation will be available on demand. We will be in touch with our sponsors in regards to the slide deck. If the slide deck becomes available, we'll upload it as a handout via the on-demand version. But otherwise, we're going to go ahead and just wrap up for the day. We hope to see you at our next webinar.